There haven't been any cases of Ebola in the Caribbean, but according to the Caribbean Public Health Agency, precautions are being taken to prevent the spread of this epidemic virus. CNews' Marie Hull visited the agency earlier today to get an update on the virus from its executive director.
Executive Director of CARPHA, Dr. James Hospitalis, describes the Ebola virus disease as one of numerous viral hemorrhagic fevers. He says although there is a low chance of the Ebola virus reaching the Caribbean shores, there are many ways countries can prepare to ensure all requirements of international health regulations are met.
Well, your international health regulations, which is the main instrument, include such things as your ports of entry, the hospitals and the capacity for infection control, communication to the public, your ability to mobilize in case of a problem, the laboratory capacity, and our countries are prepared, but still there's more that could be done to be fully ready in the event, on the unlikely event of something like this arriving in the Caribbean.
The epidemic began in Guinea in February, and according to the World Health Organization, over 1,300 people have died in West Africa. Dr. Hospitalis says prior to this Ebola epidemic, there was no approved treatment for the virus. He says although some patients may have been recently treated for the Ebola virus, experimental drugs are still being tested.
WHO has approved more than one what would be normally experimental drugs. And some people it looks as if they have done a bit better on it, but it's still early days. You have to be very careful in interpreting. Since some people get better anyway, you have to be careful in how you interpret it. Prior to this epidemic, there was no approved specific treatment for this disease. Because of the high case fatality, which in this epidemic seems to be 50–60%, but it can be as high as 90%, WHO has approved more than one what would be normally experimental drugs.
On Monday, Prime Minister Kamala Persad-Bissessar called on CARICOM to meet to determine a coordinated response to the Ebola and chikungunya virus, the two main public health threats facing the world at present. Marie Hull, CNews.